Even the gods are different. So Lord Indra is the god for Somras and Lord Shiva is the god for Bhang and Ganja. Good morning. At the outset, I thank all organizers to give me the opportunity to present this presentation. Okay, so today we will be discussing substance of abuse and dependence. Actually, as a species, we are very weak species, and as we evolve the most, we become more vulnerable to the stress, and that's why we become addicted to some or the other substances. And we all know that substance use or the substance dependence is as old as the mankind. We all know that mankind cannot bear much of the reality, so we try some of the other substances, and many are tried as aphrodisiac in hope of good effect. So while history taking, it is important to take the history of substance use or dependence. In this topic we will cover common substances of abuse and dependence, their local names, so that we can identify while taking the history, early identification of their use, sexual dysfunction caused by these substances, how to prevent them, and management. So what are the substance of addiction? Basically these are the substances which cause tolerance, that is their quota goes on increasing, and finally they cause the dependence. Apart from sexual side effects, they have immense biopsychosocial problems. We know alcohol, there are various types of alcohol starting from scotch, tequila, vodka and whiskey. But these are the some country liquors, mainly toddy or toddy and beer. So mainly while taking the history, many patients say that we don't drink alcoholic beverages, but they continue to drink toddy or beer, and they consider that these are non-alcoholic beverages. Then comes nicotine. So smoking, we all know it's harmful, but apart from this, non-smoking tobacco like gutka and khainis, this should also be taken into consideration. Other substances like hard drugs, mainly they are called hard drugs, they have altogether different ball games. Even the gods are different. So Lord Indra is the god for Somras and Lord Shiva is the god for Bhang and Ganja. We all know that cannabis, it is the drug came from the Indian hemp plant Cannabis sativa, and the main active ingredient is tetrahydrocannabinol. When the patient will come, he or she will not tell that he is consuming cannabis. They will tell that he is consuming weed or grass. And when we can suspect the use of cannabis, there will be red eyes, craving for the munchies or sweets, academic deterioration, truancy, trip to the bathroom, sudden change in the behavior and aloofness. So many times these people tend to cultivate the cannabis in home also, and they are oftenly mistaken for the ornamental plants. So basically this is the cannabis plant and all other are the ornamental plants. This is opioid. Opioid are the class of drug derived from the dried latex content from the opium poppy. There are two types of opioids, natural opioids and synthetic opioids. Morphine and codeine are natural opioids, heroin and methadone are the synthetic opioids. These are the some local names. Mainly smacks and brown sugar are commonly used local names for the opioids. So when to suspect opioid use, there can be behavioral symptoms like lying about the pain, because opioids are basically painkillers. So lying about pains, they receive multiple prescription from the multiple doctor, poor performance in the work, unexplained period of absence, isolating oneself from the friends or family and stealing medication from the other patients. There can be physical symptoms mainly about pain and poor motor skill and coordination. When they use, get dependent on the opioid, in withdrawal they will cause the nausea, diarrhea, then vomiting and pupillary constriction. These are some of the psychological symptoms. So apart from this, there are inhalants. So most common inhalants used are Febibond, petrol glues, thinner or whiteners, and these are most commonly used in the young adults like school going children or the college going children. Then comes the stimulants. So these are most commonly used like coffee, nicotine, cocaine, methamphetamines and MDMA. So ecstasy, that is a love drug, it is most commonly used in this case. Hallucinogens are the diverse group of the drug alter the perception, that is awareness of surrounding objects and conditions, thoughts and feelings, and commonly used are LSD and ketamines. They are called bottle acid or special K and cat valium. Sedative hypnotics. Sedative hypnotics mainly they are used as benzodiazepines, barbiturates and some prescription hypnotics like benzodiazepines. Then come date rape drugs. These are the drugs that incapacitated the agent which when administered to another person incapacitated the person and rendered them vulnerable to drug facilitated sexual assault including the rape. Commonly used date rape drugs are rohypnol, that is mind eraser, GHP, that is liquid ecstasy, and ketamine, that is special K. So what these drugs cause? Alcohol, we all know that in males it will cause decreased sexual arousal, impaired erection and impaired ejaculation. In female it will cause decreased vaginal lubrication, dyspareunia, difficulty in achieving orgasms, and the probable pathophysiology is inhibition of the hypothalamo-pituitary adrenal axis, reduced gonadotropin release, suppression of the testosterone, decreased release of vasodilator molecules, toxicity by oxidant molecules and neuropathy. Regarding nicotine, in male it will cause erectile dysfunction, in female it will cause decreased vaginal lubrication and delayed orgasm. We all know that probable pathophysiology is strong vasoconstriction. So this is something interesting I came across. Vaping after sex, that is smoking after sex. Smoking after sex can help to relax the body. The nicotine burst can also reduce the refractory period in between the orgasm. This means that desire for intercourse can return quickly, getting you in the mood more quickly. This serves to enhance both of your experience and is common reason why people smoke after the sex. But in long term, ultimately it is going to affect your sexual life. Cannabis causes sexual dysfunction and probable pathophysiology is decreased testosterone, CBI and CB2 receptor in the corpus cavernosum. Opioids, they reduce sexual desire, erectile dysfunction and causes infertility. Probable pathophysiology is reduced luteinizing hormone, decreased testosterone, reduced androgen production by the adrenal glands. Regarding cocaine, there will be a decreased sexual desire, erectile dysfunction, delayed orgasm, delayed ejaculation and priapism. There will be a vasoconstrictor effect. During acute administration of the cocaine, there is adrenal activation, but chronic use can lead to the neuronal non-epinephrine depletion, leading to the priapism. Stimulants, including amphetamine and MDMA, they will cause erectile dysfunction, decreased sexual desire, delayed orgasm and crystal dick. This is the condition where patient will have increased sexual desire, but there will be erectile dysfunction. Probable pathophysiology is impaired relaxation of corporal smooth muscle through action on the sympathetic nervous system, effect on MAXI-K potassium channel and intracellular calcium channels, similar mechanism of the priapism as explained for the cocaine. So always there is a risk of HIV and STD when he or she used to take any substance of abuse or substance of dependence. Approach of management as usual for sexual dysfunction due to substance, we should always dig out the history of any substance use or substance of dependence. We should always explain the relationship between substance of use and sexual dysfunctions. Assessment of the other causes of sexual dysfunction as we always do, and there is lot of psychosocial management we have to do. In pharmacological management we can use PD5 inhibitors or SSRIs for the management of erectile dysfunction or premature ejaculation. And there is always a two-way approach, that is management of the substance of abuse and dependence. It is a specialty treatment. So in this we do the detoxification, that is medical management and pharmacotherapy along with the psychological treatment. And always we have to prevent the relapse of this patient of dependence or the abuse. So in this we can do medical management or pharmacological management, psychosocial intervention and rehabilitation, and integrating them to the society. So thank you. Not on the time.
Drug-induced sexual disorder, particularly alcohol. Alcohol again treating alcohol causes sexual dysfunction as well as delusions or infidelity delusion. Again we are treating with antipsychotics which again cause the sexual dysfunction. So how you will manage all these things?
So it is basically it will be a long-term treatment. So we have to treat basic pathology, that is we have to first treat the alcohol dependence or alcohol abuse. Then we will have to go for the other like delusional disorder like delusion of infidelity and all that. Along with that we can use PD5 inhibitors. So PD5 inhibitors gives the good results in these cases.
I am Dr. Ejin, consultant psychiatrist at the Government Mental Health Center, Calicut. My question is, you have explained that this alcohol, cannabis and opioid causes sexual dysfunction. But most of the patient, this alcohol increases the performance and increase the desire, but decreases the performance. And cannabis, most of the people are telling it's an aphrodisiac-like effect. And opioid, that increases energy and decreases refractory period, and then can perform multiple sexual act with this opioid.
Sir, we all know that we cannot say which subject or which patient is going to be dependent on the alcohol. If it is used as a medicinal purpose, that alcohol in small quantity, it will increase the desire. Okay, but we cannot say whether this person or whether she or he will going to be dependent on this substance. So we should not take that type of risk. It is not advisable to use these substances to increase the sexual desire. Always there is a chance of dependence.
Bhalchandra, thank you so much, sir, for such a elaborative presentation. In this extension to what he has asked right now, I'm Dr. Pawan Rati, psychiatrist from Indore. I belong to the Ujjain Nagari, which is very close to Indore, and the Mandsaur and Neemuch, which is close built for opioids. We have seen n number of patients taking opioid for years together. And when we do the rehabilitation and de-addiction program for such patients, they improve. But sexual dysfunction is the main reason why they do relapse. So I'm also in that query mode only, ki really it causes sexual dysfunctions or not taking opioid is giving them the sexual dysfunctions. The first was this, and the another was ki how we should go ahead. Because once we start 5 phosphatase inhibitors to them, how long we should continue? Because that is the main reason why they relapse again to the opioid.
Yeah, this is the main concern. Anybody who is admitted for the rehabilitation in de-addiction center, sexual dysfunction is the main concern. It will take long time. वो बोलते हैं कि 5 साल यदि किया है उसने ड्रग एब्यूज, तो एटलीस्ट यू विल रिक्वायर 5 years to get recovered. It is like steroids.
Thank you very much, sir.
Thank you.
I now invite Dr. Parashar sir to felicitate Dr.
So I had a last question, if you don't mind. I am Dr. Jeet Nathpara from Vapi. I am a psychiatrist. Sir, any cases of inhalant use and sexual dysfunctions you have occurred or seen any cases like that?
In inhalant use, specific these children complaints of khunnas. They have high risk sexual behavior. So I have not come across any ED or PME, but high risk sexual behavior is definitely there.
Sir, to be very specific, I had seen 3 patients of premature ejaculation with inhalant use. And if you have seen any cases like any evidence about the same?
No, I have not.
Thank you, sir.
Yeah. Yeah. Thank you.